So the short answer is yes. It depends on the kind of veins that you have. So we can, there's different modalities available to treat varicose veins, starting from sort of injections of chemical sclerosants into the veins themselves. You can treat veins with laser treatment or some sort of heat delivery mechanism, so things like laser or radio frequency. And the third option is the traditional open surgical method as well. Sometimes we use a combination of things to treat varicose veins, and that tends to be the most common approach nowadays is a combination of the different methods. So, like I said, I think it depends on the kind of veins that patients have. So it could vary from simple injections where you prep the patient, you tell them what exactly you're going to do, but you would prep the area where the vein is, and then you would inject a chemical into the vein. So that's like a simple injection. The other option is sort of treating veins with some sort of heat delivery mechanism, something like laser or radio frequency, to actually deliver heat to the inner lining of the vein. And what we find is patients have, respond quite well to these treatments. They've got a very good success rate. And what happens is, as a consequence of damaging the inner lining of the vein, it becomes sticky. So as a result, the vein sort of closes up. So in the old days, we used to strip the vein out. So you'd make cuts at the top and at the bottom of the leg to pull the vein out. But for the last sort of 20 years or so, we've been using this method of delivering heat to the inner lining of the vein, but you actually leave the vein within the body. So it's not as invasive a procedure as we used to in the old days. Yes, they are absolutely safe. Like I said, I mean, we've been using them for the last sort of 20 years or so with excellent results. They're very well tolerated by patients. You could choose to perform this procedure under local anesthetic or under a general anesthetic, as the case may be, depending on the number of veins that we're usually treating. But yeah, it's a very safe, very well tolerated procedure. So yes, is the short answer. It can be uncomfortable, but that's why we sort of cover patients with anesthesia. So you would have some form of an anesthetic when you're doing these heat delivery procedures. So like a local anesthetic, where you'd numb the area where you'd introduce the laser or the radiofrequency fiber into the vein. And then a further few injections to, again, numb the area where we're going to be treating the vein. If you were having a full general anesthetic, then that would be, again, performed under anesthesia. After the operation, patients will have some discomfort for a few days. Usually that lasts about 5 days to a week. But it doesn't stop people from going back to their normal activities. In fact, if anything, I encourage my patients to start doing everything sort of the very next day. So even if we've done sort of a combination procedure where they've had heat delivery to the main trunk of the varicose vein and little cuts to take the little visible branches away, and then I'd put their legs in a bandage, I would get them to walk and do everything that they normally do pretty much straight away. So even with the bandage on, I'd get them to walk around, do things that they would normally do. Your second question was about the side effects. Yes, any procedure that we perform, there are some risks, some complications that can happen. So the common things with this procedure is a risk of bleeding. You're working on veins which are full of blood, so obviously there is a small risk of actually causing bleeding. The bleeding tends to happen underneath the surface of the skin, so it manifests as a bruise. And usually that is what patients find, that for the first sort of couple of weeks, they can have some bruising around the areas where we've treated the veins. If you were to have cuts or open surgery as well, then there is a small risk of infection in the cuts that we make in the skin. The big risks that I tell my patients about always is a small chance of actually inducing a clot in the deep veins. And that risk is quite rare, but because it's a significant thing that can happen, it's important that the patients are aware of this risk. And there's always a chance of the veins coming back. So there is a recurrence rate that is associated with varicose veins. And that is because we only target the treatment to the vein that is not working properly at this point in time. You do have other veins in your body, in the leg, which, even though they're working normally at this point in time, it may be that in the future that they start to cause problems and give you varicose veins in the future. Also, the body is a wonderful thing, so you can form new connections and new veins. Sometimes they can give rise to new varicose veins. So you may need more treatments in the future, depending on what's happened. So again, it varies from the amount or the number of veins that we're treating. But if I was to give you a ballpark figure, sort of it varies between, for laser procedures, you're looking at something about £2,500 as a minimum, and then sort of roughly in that ballpark, depending on how many. So if you've got veins on both legs, say for instance, the treatment may cost a little bit more. If it's purely injections, the cost will be significantly less than that. So again, sort of what we would normally do is, once I see someone with varicose veins, I will advise them after seeing them as to what the costs would roughly be. But that's sort of like the ballpark figure we're looking at. Yeah, so many stories, to be honest. I mean, this is one of the commonest procedures that I perform as a vascular surgeon. So many patients who, present and, they've come with sort of really significant varicose veins where they just haven't really sought any medical help. And, I remember there was a family with two brothers who both had very significant varicose veins who came to see me. The younger brother came to see me first, and he said he'd had veins for such a long time. And he worked in an industry where he had to be on his feet for quite a long period of time. So he had sort of very significant symptoms from his varicose veins. And I operated on him, and he came back to see me after his procedure and was so pleased. He was so happy that his symptoms had resolved completely. He even got his brother to come back and see me, and I treated his brother as well, who again thankfully had a very good result. So I mean, there's so many successful stories of patients having had treatment for their varicose veins.